Foundayo, Orforglipron, is the new appetite pill that works through GLP-1. You can take it without fasting, meal timing, or water limits, with or without food. It is taken once daily and starts at zero point 0.8 milligrams. Foundayo removes the injection and fasting burden. It does not remove gradual dose increases, stomach side effects, or the need to choose the right patient. Foundayo is approved for adults with obesity or overweight, plus a weight-related medical problem. It is used with reduced calories and increased activity. It is not a weight loss supplement and should not be combined with another GLP-1 medicine. Foundayo is a chemical pill, unlike protein-based medicines in the GLP-1 class. It activates the glucagon-like peptide-1 receptor, called the GLP-1 receptor. That signal reduces appetite, helps fullness arrive sooner, and slows how quickly food leaves the stomach. Food does not meaningfully change how much Foundayo reaches your blood, so fasting is unnecessary. You can take it with or without food. You do not need an empty stomach or a waiting period before breakfast. Basic dosing rules still apply. Swallow Foundayo whole once daily without crushing, chewing, or splitting it. Take a missed dose when remembered, but never take 2 tablets in one day. After 7 or more consecutive missed doses, call your prescriber before restarting at a lower dose. The starting dose is 0.8 milligrams for at least 30 days. It then rises to 2.5 milligrams for at least another 30 days. The next step is 5.5 milligrams. Later options are 9, 14.5, and 17.2 milligrams, with at least 30 days before each increase. The schedule gives your stomach and bowel time to adjust. Moving faster can worsen nausea, vomiting, and dehydration, making treatment harder to continue. A tolerable lower dose is often more useful than a higher dose you repeatedly stop taking. The trials combine this dose schedule with guidance to eat fewer calories and become more physically active. The measured result came from medication added to that plan, not medication replacing it. This sets realistic expectations. The main obesity trial followed adults without diabetes for 72 weeks. Average weight loss was 7.4% on 5.5 milligrams and 8.3% on 9 milligrams. It reached 11.1% on 17.2 milligrams. People taking a placebo, a pill without active medicine, lost 2.1%. The pill worked, but the dose influenced the result. For someone starting at 220 pounds, an 11.1% average reduction equals about 24 pounds. That is noticeable, but it is still an average. Some people lost much more, while others lost little or stopped treatment before the final measurement. Adults with type 2 diabetes lost less weight in a separate 72-week trial. Average loss reached 9.6% at the highest dose, compared with 2.5% on placebo. A person with diabetes should not expect the 11.1% average from the trial without diabetes. A daily pill does not give everyone dramatic results. At the highest dose, 18.4% of adults without diabetes lost at least 20% of body weight. Most did not reach that mark. Foundayo offers convenience, not a guarantee of dramatic loss. It has not been proven superior to Wegovy or Zepbound in a direct obesity trial. Comparing separate studies can mislead because participants, doses, and trial designs differ. A pill may fit your life better without being the strongest option for your target. Strength is only one side of the choice. How well you tolerate it is the other. At the highest dose, nausea affected 35%, diarrhea 25%, constipation 24%, and vomiting 24%. These effects were most common during dose increases and often eased later. Severe stomach and bowel reactions occurred in about 3% of treated patients versus 1% with placebo. Persistent vomiting or diarrhea can cause dehydration and kidney injury. The warning sign is not one unpleasant day. It is symptoms that continue, prevent drinking, or reduce urination. Severe upper abdominal pain that will not settle needs urgent evaluation, especially when it reaches the back. That pattern can signal pancreatitis, meaning inflammation of the pancreas. Fever, yellow eyes, or right upper abdominal pain can instead point toward a gallbladder problem. Across the two weight management trials, 8% of Foundayo users stopped permanently because of side effects compared with 3% on placebo. Most stops involved stomach or bowel symptoms. How well you tolerate Foundayo is not a minor comfort issue. It directly determines whether you can keep taking the medicine. Success does not depend on whether treatment is a pill or a weekly injection. It depends on whether you can take the dose consistently, tolerate it, afford it, and lose enough weight to justify continuing. Convenience matters only when it supports consistent use. Your target also changes the decision. Someone seeking a 5 to 10% reduction may find Foundayo sufficient. Someone needing larger loss for severe sleep apnea, mobility limits, or another urgent problem may prioritize a treatment with stronger expected weight reduction. Even when the expected loss fits your target, other medicines can change the safe dose. A liver enzyme breaks down Foundayo. Some drugs slow this enzyme and raise Foundayo levels, while others speed it up and reduce those levels. When another drug strongly slows that enzyme, the maximum Foundayo dose is 9 milligrams. Drugs that speed it up too much should be avoided. Foundayo can also change the amount of oral medicines reaching your blood. The cholesterol drug simvastatin must not exceed 20 milligrams daily when used with it. Oral birth control may work less reliably after starting and after each dose increase. Use a non-oral method or add condoms for 30 days during those periods. Other diabetes medicines can change the safety picture. Foundayo can cause low blood sugar. The risk rises with insulin or a sulfonylurea, a drug that pushes the pancreas to release insulin. Those doses may need adjustment rather than waiting for repeated lows. Some people should avoid Foundayo entirely. Do not use it with a personal or family history of a rare thyroid cancer called medullary thyroid cancer. The same applies to multiple endocrine neoplasia type 2, an inherited condition that raises tumor risks. A previous serious allergic reaction to Foundayo is another reason not to use it. Stop Foundayo during pregnancy because it may harm the developing fetus. Breastfeeding is not recommended during treatment. Severe gastroparesis means very slow stomach emptying, and Foundayo can slow it further. It is also not recommended when liver function is severely reduced. Eligible patients need one precaution before procedures. Tell the anesthesia team that you take Foundayo. Slower stomach emptying can leave food behind, despite normal fasting. Food left in the stomach can enter the lungs during sedation. Do not create your own stopping schedule because the correct plan depends on the procedure. Beyond procedure planning, check whether your current dose is helping. Review weight change, hunger control, waist size, side effects, and regular use. A convenient pill that produces little benefit should be reconsidered. A moderate result with manageable side effects may still justify long-term treatment. Take it once daily, increase it slowly, and judge it by results rather than novelty. The best choice is the treatment you can safely continue, and that produces enough benefit for your medical needs. A needle-free option is valuable, but convenience is not the outcome. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.